lavender is my favorite. It's very relaxing and calming. And I just put it on my temples before I go to bed. And if I'm having anxiety about being in a different place and, afraid that something's going to happen while I'm gone, it usually soothes me.
And on the topic of travel, a lot of questions came up about how we actually deal with illness while we're traveling. And if it's difficult to find care when you're in a different country or a different state, how do you deal with that?
Well, I went into a blog about something similar. I did how to travel with a chronic illness. I have lupus and Sjogren's syndrome. So my situation may not relate to everyone, of course, but I usually, of course, before I leave, I'll go to my doctor and ask them if I can have a prescription for like an extended period of time past what I'm traveling, just in case, for whatever the reason, I'm stuck in a country. In the past, I've, been held in a country for way longer due to, weather related incidents. I'll tell you about the Netherlands one time. That can be another conversation for a different day, but it's always good to have backup medication. And also what I like to do is I like to bring things with me that I use at home whenever I'm having a flare up. I'm not giving medical advice, but something that I like to do is bring ace bandage wraps, and I'll kind of wrap my arms and legs sometimes like a mummy, and it just kind of comforts me. I'm not giving you tips on what to do. You can talk to your doctor about it. But I also like to stay really clean. I have a sanitation kit that I always carry with me when I'm traveling on planes and buses and trains. It has hand sanitizer, antibacterial wipes. It has a mask. I've been wearing masks long before COVID.
I was going to ask if this was a pre-COVID thing as well. Yeah,
for sure. Yeah, I already had like the whole COVID thing down by the time it happened. So gloves, of course. You should see my whole routine. Some people look at me and they're like, huh, interesting. I'll take like my gloves, I'll like wipe everything down like a crazy person, and then I'll like take my gloves off. And then like everything that I was using to clean the plane will stay in the gloves. So like wipes and all of that stuff. And I just throw it away like that. It's its own little bag in the glove.
Yeah, you've got to figure it out.
Yeah, so there are a lot of things, but I'm sure I'm missing a lot. What do you say to all that, Melissa? What do you do for your medical care when you're traveling?
I would say the advice of being prepared as though you might have a longer period of time away is a good tip, because I've also done that in the past for different things. Also being in touch with the healthcare provider from wherever my base is, if I have one, is helpful, because often in other countries, like someone asked the question of how you make sure a new doctor knows your medical history. And I find that's not always the best approach to things. Sometimes it's best to have your own doctor send suggestions or send a prescription for what's going on, and then talk to the doctor about how you are working with a specialist and see if they will help you out with that. And rather than going into my whole history all over again for a place I'm only going to be in for a couple of days. So it's sort of different in every situation, and you have to be prepared to talk to different doctors or to go to emergency if something comes up. But also, like you said, try to have everything with you that you might need if it's possible.
Yeah, I agree. And I went to, in my blog on my website, I went into more detail about all of this. But I think something that's really important that a lot of travelers don't think about is to make sure that the medication that you take is legal in the country that you're traveling to also.
That's a good point.
Definitely don't want to be arrested for something that is like forbidden. But also I think something that has helped me in the past, I've traveled on airlines where they needed my documentation about the medication I was taking. So any documentation that you can bring with you in advance from your doctor that says, my patient takes this for this chronic illness, et cetera, and, signed and dated, and have that with you in your medical folder or, your medication bag or what have you. And make sure that you don't take your pills with you on the trip without having them in the bottles, because that is a no-go, not just traveling.
It's a very good point.
In general, you can't just bring random pills with you without having, your name on the bottle.
Yeah. Yeah, that's a very good tip, and something that is tempting to do, especially if you're trying to pack as small as possible.
Oh
Just to
yeah.
combine everything into a Ziploc bag, which definitely looks suspicious in some situations.
Trust me, I've been tempted to do that. It's much, much easier than
I've
carrying all of your
definitely
pockets.
done it.
Oh, you have?
But yeah, but I can, yeah, even when I've done it, it's been in situations where I'm sure it's fine, but something that I should probably assess more in the future for certain destinations. Are
Oh, I
there
love
things that you
it.
take with you aside from what you mentioned? Are there other remedies that you always carry when you're traveling?
Remedies like holistic stuff, non-medication.
Any medication or other therapies?
So something that always seems to help me when I'm having inflammation is Advil. I don't recommend you take it unless, you consult with your medical
Mhm.
provider first. But it's something that just helps me. I get a lot of headaches and aches and pains, with my lupus. And just taking two usually helps me. Also, I have allergies, so I take Benadryl sometimes. I try to limit the amount of things that I take and take only the medication that I absolutely need to for my well-being.
Mhm.
But something that's just simple that anyone can do if they're not allergic is I like to take these little roller balls of it's like scented oil, and lavender is my favorite. It's very relaxing and calming. And I just put it on my temples before I go to bed. And if I'm having anxiety about being in a different place and, afraid that something's going to happen while I'm gone, it usually soothes me. I don't know about other illnesses, but with my lupus, when I'm stressed, I get a
Mm.
flare up. So any way that I can make the surroundings more comfortable for me is going to help me not get a lupus flare up. But I usually travel with people. I don't usually like to travel alone. And I haven't recommended that ladies travel alone in the past. I mean, you do you, of course. But with so many things that are happening that you hear about all the time in the news, singles, ladies traveling, for me, I would rather just be safe.
Mhm.
So,
It does take the pressure off to travel with someone. I mostly travel with my partner, and sometimes we do trips without each other. So I'll be on my own, but it's definitely easier, especially if something happens medical wise and you need to find care. It's somehow the moral support helps. Even if
oh
you end up
yeah.
having to do everything on your own, it's still helpful to have someone there just to support you in that way.
Yeah, and also like you said, because if you have your support there, then like let's say you can't walk for whatever the reason, or you're in so much pain, they can, help call your doctors, help get you to the ER and whatever treatment you need.
With what I take with me, it's not, I don't take, there was a period of time where I didn't take anything. After I recovered from the chronic UTI, I just didn't take anything, which is probably a little bit of denial because traveling the way that I do, something was bound to happen. And I did get a mild UTI in Malaysia from food poisoning at one point, and I had nothing to take. And I didn't have time to see a doctor. I was in an area where it wasn't really possible. And I think if I had have had things to take to help with the UTI, it wouldn't have lasted as long as it did. But as it was weeks of trying to get on top of it rather than what might have been a couple of days. So I now travel with things that might help in that situation, even if I'm fairly confident it's not going to happen.
Wow, that's a really good tip though, because you don't want to be, elsewhere with the UTI and not have like anything, because they can be really painful.
Yeah, and it gets scary if you're in a remote location. Even if you've never had a kidney infection, it can be scary that it might happen this time. And of course, that can be
Oh
quite
yeah.
serious.
Totally. And actually, it's funny that you mentioned the kidney infection. For those of you out there who have lupus, a UTI can be very dangerous because, as your kidneys, if you have, especially if you have systemic lupus, as I do, your kidneys, that is like something that we're always thinking about with our rheumatologists, how
Mm.
to make sure our kidneys, don't get affected. So take care of the UTI first so that it doesn't turn into a kidney infection. But you had mentioned about being away from home and getting the UTI from, did you say you got it from food poisoning? Did I hear that right?
That's the theory anyway. I had a
Yeah, that's
mild
possible.
bout of food poisoning for a couple of days. And then, I mean, because it went on for a couple of weeks, I did manage to get tested. And it was the first time I had a positive UTI test. because every other time for that 5 years it had been mixed growth or inconclusive or negative. So it came back as Klebsiella, which is quite common for food poisoning. And that is why it's likely that's why it happened. And of course, you never know for sure where it comes from, but it did coincide with a period of having an upset stomach and other symptoms of mild food poisoning. And so I assume that is what happened, but you never know.
I had no idea that you could get a UTI from food poisoning. I always assumed that it was something down there, vaginally that created the environment for the UTI.
Well, the theory of it starting with the digestion is that if you have diarrhea or if you have something else going on, even constipation, the bacteria can move from there to the vagina to the urinary tract. So everything's connected down there in one way or another. And it could happen from different causes.
Okay, I thought you meant like internally because you had food poisoning somehow.
I wouldn't be surprised if we find out that bacteria can travel to the bladder in other ways, but that hasn't been shown yet. So it's just speculation.
Right. But actually, that reminded me of something. When you travel, you should make sure that you have the type of insurance that allows you to get care in another country. So you're not stuck with like, 6-figure bill or something, or 10-figure bill. I've heard horror stories.
Yeah, me too. It's difficult to get insurance that covers you all over the world as well, which is something I had to spend quite a bit of time finding, but it's a good piece of advice. It really makes a difference.
Yeah, maybe that's something that you can share with our audience who are curious. What kind of insurance did you get that allowed you to travel?
It's easier if you have a home, because then you can get travel insurance for most regions in the world. So that's not too difficult. But if you don't have a base, that's when it gets tricky, because insurance needs to be based somewhere. And that's when it got difficult for us, because we didn't have an address anymore. But we did manage to find one company that did global insurance. And I think now it might be more possible. But I would just say, if you do have a base, try to find insurance that covers all the regions that you're going to, and make sure you check that print, because a lot of countries are excluded.
That's a really good tip.
Thank you for tuning in to our special interview. We loved answering your questions and getting to know each other a bit more. For more information on chronic conditions, fun travel adventures, and all that jazz, follow us on social media and at our blogs. If you like this video, give it a thumbs up and leave us a comment down below. See you next time.